How to start your home care agency in the state of Florida. Are you ready to start your own non-medical home care business in Florida, but don't know where to begin? Whether you're looking to provide light household help or hands-on personal care, Florida offers two main paths: Homemaker and Companion Services or a non-skilled home health agency. In this video, I'll walk you through the key differences, how to set up your business, what licensing or registration you'll need, how to become a Medicaid provider, and the exact steps to get started the right way. Let's dive in. First, let's look at the difference between Homemaker and Companion Services and non-skilled home health services. In Florida, Homemaker and Companion Services are designed to help clients remain safe and comfortable in their own homes without providing any hands-on medical or personal care. That means you're not assisting with bathing, dressing, or any activity that involves direct physical contact. Instead, your services focus on housekeeping, running errands, and providing companionship. You don't need a nursing license to operate this type of agency. A non-skilled home health agency is allowed to provide hands-on personal care services such as bathing, dressing, grooming, and feeding. Because you're providing direct care, you'll need a home health agency license through the Agency for Healthcare Administration. An RN must supervise the care your aides provide, and your agency will have to pass an on-site survey before you can start seeing clients. Whether you're starting a Homemaker and Companion Service or a non-skilled home health agency in Florida, one of your first steps is choosing the right business structure. You can register as an LLC, a corporation, or even operate as a sole proprietor. Many agency owners choose an LLC for the legal protection and flexibility it offers. Once you've decided, head over to sunbiz.org. That's Florida's official Division of Corporations website to register your business name and file your formation documents. Then don't forget to get your EIN or employer identification number from the IRS. This number is like your business's social security number. It's required for taxes, hiring employees, and opening a business bank account. Obtain an assumed or fictitious business name. If you're operating under a name other than your legal name or entity name, you must register a fictitious name with the state through the Sunbiz website. If you're opening a Homemaker and Companion Service, you'll apply for registration only through AHCA. This is a simpler process. There's no on-site survey, but you still must follow state regulations. If you're starting a non-skilled home health agency, it is more involved. You'll submit a detailed licensure application, meet staffing requirements, and prepare for an on-site survey by AHCA to prove you're ready to provide safe, compliant care. The AHCA website is where you'll find all the forms, fee schedules, and contact information you need for both types of services. Next, you'll need to complete a Level 2 background screening. This applies to all owners, administrators, and anyone who will have direct access to clients. The screening is done through live scan fingerprinting and must be processed by an AHCA-approved vendor. Whether you're opening a Homemaker and Companion Service or a non-skilled home health agency in Florida, you'll need to have some basic policies and procedures in place before you can start serving clients. These don't have to be as complex as a skilled nursing agency's manual, but they should clearly outline how your business will operate and protect your clients. At a minimum, you should have a service agreement template for your clients, emergency protocols for things like hurricanes, power outages, or client health emergencies, incident reporting forms so staff can properly document any unusual events, clear abuse and neglect reporting procedures to stay compliant with Florida law, confidentiality standards to protect client information, and a complaint procedure so clients know how to raise concerns and you can address them promptly. Even though the Agency for Healthcare Administration doesn't require liability insurance for Homemaker and Companion Services or non-skilled home health agencies, it's one of the smartest investments you can make. At a minimum, consider getting general liability insurance, workers' compensation insurance if you plan to hire employees, and professional liability coverage. Next, let's talk about staff training and documentation, two areas that can make or break your compliance. Whether you're running a Homemaker and Companion Service or a non-skilled home health agency, you'll need to keep detailed records for both clients and staff. For clients, maintain intake forms with emergency contacts, service logs showing exactly what was done and when, notes on dietary needs, supervision requirements, and any incident reports. For staff or contractors, keep health certifications, completed background checks, signed service agreements, all submitted care notes. The following are the mandatory annual training topics required in Florida: HIV/AIDS in-service training, Alzheimer's and dementia training, infection control, abuse, neglect, and exploitation prevention, emergency preparedness, and patient rights and confidentiality. Documentation and client records. Florida regulations mandate maintaining confidential client records, including client contact and emergency info, scope of services provided, physician information, service agreements or contracts, visit logs outlining duration and types of visit, dietary needs, allergies, activity limitations, termination notices with documentation of reasons, documentation of any incidents, geographic restrictions. When you submit your registration application in Florida, you'll need to specify your geographic service area, typically one or more counties where you plan to provide care. If your agency plans to serve clients outside of those designated counties, you must have a documented supervision plan for those non-primary areas. Submit your application to AHCA. Once you've completed your non-skilled home health agency application, submit it along with all required documentation and fees to AHCA. After submission, AHCA will review your application and respond within 30 days if they need additional information. Once your application is complete, AHCA will approve or deny your licensure within 60 days. Respond to application omission notice, if applicable. An application omission notice is a formal notification sent to an applicant when their submitted application is incomplete or missing required items. What triggers an omission notice? Common reasons you might receive one: missing or unsigned sections of the application, failure to include the registration fee payment, incomplete or missing ownership details, missing or incorrect background screening documentation, failure to list all counties where services will be offered, missing administrator contact or business address, expired or unregistered fictitious name, incomplete or missing attachments like policies or operational plans. How to effectively respond to an omission notice. You will be given a time frame to respond, usually 21 days from the date of the notice. If you correct and return the information within the time frame, your application continues through the review process. If you don't respond or fail to correct the issues, your application may be denied or considered withdrawn. Read the notice carefully. AHCA will list everything that's missing. Gather the documents or corrections. Submit all requested info together via the method they instruct, usually mail or electronic. Include a copy of the original omission notice with your response. Number your attachments clearly to match each item listed in your response. Keep a copy of everything you send in case of future inquiries. Send it using a trackable delivery method, e.g. certified mail or email confirmation. Contact AHCA if you have questions. They can clarify what's needed. On-site survey. When it comes to on-site surveys, AHCA treats Homemaker and Companion Services and non-skilled home health agencies differently. For Homemaker and Companion Services, AHCA does not routinely conduct on-site surveys since these agencies are registered, not fully licensed. This means the regulatory requirements are lighter. However, AHCA can conduct an on-site visit if there are complaints, issues with background screenings or registration, or during random audits to ensure compliance. On the other hand, non-skilled home health agencies must pass an on-site survey before licensure. This is part of the licensing process to verify compliance with state regulations. Even if your agency isn't subject to routine visits, it's wise to operate as though an on-site survey could happen at any time, keeping your records, staff training, and policies in order. Renewal timelines. Once your registration or license is approved, it's important to keep track of renewal timelines to stay compliant. For Homemaker and Companion Services, your registration must be renewed every 2 years. Additionally, all required background screenings need to be updated every 5 years to maintain compliance. For non-skilled home health agencies, licensure also requires renewal every 2 years, with the same 5-year background screening updates. Mark your calendar and plan ahead to avoid any lapses that could impact your ability to provide services. Staffing requirements for a Homemaker and Companion Services agency in Florida. Administrator, responsible for overall management and compliance of the agency. No specific license required, but must have relevant experience in health services or management. Alternate administrator, Serves as backup to the administrator with similar qualifications. Caregivers. Provide non-medical services such as housekeeping, errands, companionship, and medication reminders. No nursing license or formal healthcare certification is required for caregivers. Staffing requirements for a non-skilled home health agency in Florida. Administrator. Must have at least 2 years of experience in health-related services, supervision, or management. Alternate administrator. Serves as backup to the administrator and must meet similar qualifications. Registered nurse supervisor. Must be a Florida licensed RN responsible for supervising all CNAs, home health aid services, and personal care assistants. CNAs, home health aides, and personal care assistants. Provide hands-on personal care such as bathing, dressing, grooming, feeding, and ambulation assistance. Must be trained and supervised under state regulations. When it comes to billing, you have 2 main options. You can operate as a private pay-only agency, which is the simplest way to start, or you can become a Medicaid provider by applying and enrolling separately through the state's Medicaid program. Each option has its own requirements, so choose the one that fits your business goals best. Once you're licensed as a home health agency, you are eligible to enroll as a Medicaid provider. Start by visiting the Florida Medicaid Provider Enrollment Portal. You'll need to submit a provider enrollment application along with important documents, including your home health agency license, your National Provider Identifier or NPI, IRS documentation, and Level 2 background screening results. After submitting your application, you'll choose which Medicaid programs to participate in. In Florida, home health services can be reimbursed through fee-for-service Medicaid, Medicaid managed care organizations, and various Medicaid waiver programs like the long-term care waiver, developmental disabilities waivers known as iBudget, and the traumatic brain and spinal cord injury waiver. Before approval, Florida Medicaid requires all new providers to complete essential training. This includes provider training on Medicaid policies, HIPAA, and compliance education. If you plan to work with managed care organizations, additional managed care training may also be required. Once your application is submitted, be prepared to wait. Processing times can take up to 60 days or even longer. After approval, you'll receive your Medicaid provider number, along with detailed instructions on billing procedures. You'll also get information about contracting with Medicaid managed care organizations if applicable. Remember, staying compliant with Medicaid rules is crucial. All services must be properly documented, authorized, and billed according to policy. Resources. Below you'll find a full list of helpful resources, including links to register your business, apply for your EIN, apply for your license, explore Medicaid waiver enrollment, and more. Starting your home care business allows you to make a real difference in the lives of seniors and individuals who need your support in your community. You are changing lives, one client at a time. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you. And feel free to share this with anyone who might find it useful. See you in the next video.